Poor baby. Probably has a cold. You probably need to see the pediatrician. Oh man, what is that cough? Let's talk. Hi, and welcome back to Pocketbook Pediatrics. I'm Dr. Rishanan Brown, and as usual, I'm always so happy to have you here with me today. So we'll be talking about cough, a little bit cough. Sometimes it can be quite distressing, not only to the child, but to the parent or the caregiver as well. And especially when it's a very heavy cough or it has that rattling sound, and especially when it has been going on for some time. I think it's important for us first to find out or talk about what is a cough really. So a cough is our body's natural reaction to clear the airways or the windpipe of any secretions or anything that might be causing it some irritation. And I know we've all had that experience where we've had something to eat or drink and we swallow and it goes down the wrong way or down the wrong throat, as we say sometimes here in Jamaica. And we cough. It's the body's natural way to keep our airway clear. So there are many different reasons that we may cough. And there are many different areas in the body actually that may be stimulated that causes cough, not just the lungs or not just the windpipe itself. Sometimes it's the sinuses in the face, sometimes it's our ears, sometimes even the stomach and other places in the body can be stimulated and cause us to cough. But I know that is one of the main reasons that you present to your pediatrician, so let's talk about it a little bit more. Now, I must start off the conversation by saying that all cough is not cold, okay? It's a common misconception, particularly here in Jamaica, that a cough means that you have a cold and you need medication to stop it. But it's not, it's simply that reflex reaction that we spoke about, and it's not the problem itself, but it's a symptom of a problem. So we need to get down to what the actual problem is. Now, even healthy children may have cough up to 10 times per day, and it's not considered to be associated with anything associated with illness. And as I said, many things may be stimulated to cause you to cough. But we have to look at some characteristics of the cough. So a cough may last up to 2 weeks, and we call that acute or short-lived. And that may be due usually to a cough and cold. It may be allergies that are going on, or it may be something in your immediate environment. Is there smoke? Is there some strong smell that is causing an irritation? And that usually leads to a short-lived cough. But then there are also the longer coughs or chronic cough. And when that's happening, that's not usually a cough and cold. It can be something else like asthma. Allergies again can be chronic as well as acute. And as I said, different areas of the body. So problems with the heart can cause you to cough. Problems with the stomach, like reflux, can cause you to cough. And then we also have to think about long-standing infection. So something like tuberculosis or TB, is that the reason that you're having this cough? And so your pediatrician, of course, is going to take a full history and do an examination. Now, when we take the history, we're going to ask those questions that help us to deduce what the problem is. We're going to ask things like, what does the cough sound like? Is it wet? Is it dry? Does it sound like a dog barking? That's one of the questions we ask. Is it happening at a particular time of day? What else is associated with the cough? Is there any fever, any weight loss, any vomiting? Is there anything else that can tell us what exactly is the problem? All right? And of course, we're going to do a full examination of your child. Now, we're definitely first going to look to see if there's any distress for your baby. Are they having difficulty breathing? That we need to intervene now, or probably even transfer to the hospital for intervention if it's something that we can't manage in the office. And if that's not the case, we're definitely going to continue examination, looking for those other things that point us in a particular direction. So has your child had any significant weight loss? And are there any obvious signs that point us in a particular direction, like that fever and runny nose and red throat that might suggest this might be a viral illness that is happening? We definitely also listen carefully to the chest to make sure that there's no signs of wheezing or any other sounds on the chest that would suggest that an infection is going on. Now, as most coughs are caused by a common cold, a pediatrician may not order any specific investigation. But if they do think that something else is going on, they may order a chest x-ray or anything else that they might think will help them to hone down on what is causing your child to cough. Now, how do we treat a cough? Because I know it's very important to stop it. But remember, we said many different things cause a cough, and so the treatment is going to depend on what is the cause of the cough. Some will require antibiotics, some will require allergy medication, some may require nothing at all. So it's not possible for us to talk about every single type of cough here today. So let's continue on that line of talking about the common cold and how we treat a cough related to that. Now, a common cold is caused by many different types of germs, and this is usually a virus. So when we talk about giving a medication, an antibiotic is not an appropriate treatment for a cold because antibiotics treat bacteria. And as I said, usually a cold is caused by a virus. Now, the symptoms that come along with a cold can be annoying, yes, but they usually clear up within a week or two without any intervention. But then there's that cough, which may sometimes linger on even after the other symptoms have gone. So what do we do about that? Well, remember we said earlier that a cough is protected. Now, when you have a cold, the virus does produce a lot of mucus or secretions, or what we call the cold. And the cough helps to clear these secretions out of your lungs and your airways. So we don't want those secretions sitting there to cause an infection from bacteria, which will then actually need antibiotic therapy. So truthfully, sometimes we don't want the cough to stop because it is helping us in the treatment of the cold. So hang tight, everything should clear up without any intervention. But then again, we do know sometimes that the cough is not just annoying, it actually becomes disruptive. It might be disrupting your sleep or your child's sleep, or there may be other symptoms associated, maybe vomiting after you're coughing. And so at this point in time, it would be appropriate to do something about it. But before you just pick up any cough and cold medication from over the counter, please have a conversation with your pediatrician. And that's because most over-the-counter medications really are not safe to be used in children, and particularly children who are under 6 years old, so we don't recommend them. And we say that because these medications usually have a suppressant or something that dampens down the cough. But it doesn't only dampen the cough, it can also make your child very drowsy, and it can dampen down their breathing rate or slow their breathing rate. So the proposed harms from using these medications are worse than the proposed benefits from using them. So we don't suggest them at all. And as a matter of fact, most of these medications actually haven't been found to be truly effective in treating the cough or in shortening the length of the cough and cold. What actually has been found to be effective is simple honey, 1/2 to 1 teaspoonful as needed. Now, there's a caveat here though, in that this is not safe to be used in babies who are less than 1 year old. It can cause another problem called infantile botulism. But for older children, it's simple, it's effective, and it's safe. So go ahead and use that. All in all, if your symptoms are not overwhelming, your pediatrician will likely suggest watchful waiting, which means basically supportive care. So we'll encourage a lot of hydration, we'll encourage honey, and we'll also encourage good cough etiquette. So it's a good time to teach your kids to cough in the elbow and also to use a lot of hand washing as well to prevent spread of their infection to other people in your household or at daycare or wherever else they might be cared for, right? But if your symptoms are not getting better in good time as we would expect, or they're worsening, this definitely would warrant reevaluation. So take your child back for a review for your pediatrician. So to wrap things up, remember that all cough is not cold. There are many different reasons that we cough. And even healthy kids can cough several times for the day without there being any problems at all. A cough sometimes can be protective, so we don't always want to stop it. But if you do have concerns that it's going on for longer than it ought to or it's worsening, definitely speak to your pediatrician for further intervention. And remember that the cough from a common cold usually will clear up within about 2 weeks. So hang tight, it will get better. Thank you so much for joining me here today. I really hope that this has helped you to understand cough a little bit better and put your mind at ease for the next time that you might have to deal with a common cold for your child. I really enjoy having you here with me. Thank you so much for watching. I look forward to seeing you next time on Pocketbook Pediatrics. God bless.